Dr. Slaoui is arguably the world's most experienced and successful vaccine developer, responsible for some of the major recent breakthroughs in vaccines. General Perna oversees one of the world's largest logistics and supply chain operations, the one that keeps the Army running. 3 highly accomplished career HHS scientists will oversee each area of Operation Warp Speed. Dr. Peter Marks of FDA for vaccines, Dr. Janet Woodcock of FDA for therapeutics, and Dr. Bruce Tromberg of NIH for diagnostics. This is truly a dream team. We started work on each of these areas in January, and Congress has provided nearly $10 billion explicitly for this kind of research and development effort. Operation Warp Speed will integrate existing efforts that are coordinating vaccine, therapeutic, and countermeasure development, including NIH's ACTIVE and RADx initiatives. This week, HHS and DoD already announced new contracts to manufacture hundreds of millions of needles and syringes here in America for distributing an eventual vaccine. Finally, the President's efforts will ensure not only that we get vaccines, therapeutics, and diagnostics faster, but that we get large donations of the eventual products so they're affordable for the American people.
It's a great honor and privilege for me to have the opportunity to serve our country and the world in this remarkable endeavor, extraordinary endeavor, helping them and supporting them do it. The Operation Warp Speed's objectives are very clear. The President has described them, and I believe they are very credible. I also believe they are extremely challenging. However, I am really confident that our team across the many governmental agencies that are involved in these efforts, the NIH, the CDC, the FDA, ASPR, and of course with the support of the Army and our partners in the private sector, will be able and will do the utmost to deliver these objectives. In fact, Mr. President, I have very recently seen early data from a clinical trial with a coronavirus vaccine, and these data made me feel even more confident that we will be able to deliver a few 100 million doses of vaccine by the end of 2020. And we will do the best we can to do that. Thank you. We will of course also focus on progressing and accelerating development of medicines for those who unfortunately already caught the virus, as well as optimize the diagnostic tests. This will be our focus 24/7 over the next many months. Thank you. Thank you.
I'm very excited about this team. It will be historic as we execute the mission that's been given to us. I also feel very confident that the team will be able to provide the results as directed. It is going to be a Herculean task, but the combination of the 2 main partners between Health and Human Services and the Department of Defense, their combined strengths, partnered with the other teammates, will ensure our success. One of the great advantages that we have as a military is our ability to do logistical and sustainment operations afar. We're just going to apply those capabilities to this mission. This mission is about defeating the enemy. We will defeat the enemy. Why? Because winning matters. And I'm excited to be a part of this team. And Mr. President, thank you.
Thank you very much.
We're working for a fully approved vaccine, but we'll also use the tools we have, for instance, emergency use authorization as appropriate. We use all of our regulatory tools to bring vaccine available for the entire American population by January.